First of all, I just want to say it's an honor to be here. Thank you very much for your kind invitation. I'm going to talk about the MRCPsych Examinations. These are examinations that our trainees undertake in years 1 to 3 of core training in the United Kingdom. The exams have undergone a major change because of changes within training in the United Kingdom and because our regulator has, in a sense, implemented on all Royal Colleges and all specialties the need for examinations to be more reliable, robust, and above all standardized. And so our new MRCPsych examination, launched in 2008, was a response to the principles as laid out by our regulator. Now, a general summary of our exam. Everyone will have to have passed 3 written papers. They will then go on to take a clinical exam called the Clinical Assessment of Skills and Competencies. And it's based around a complex OSCE system where candidates actually undertake a series of 16 stations. And I'll talk more about that later. In order to take the exam, in the UK, candidates should, during the course of training, progress through something we call the Annual Review of Competency, which is a series of work-based place assessments that trainees undertake in the workplace, and every year they are signed off. For those not in training, or for those overseas, we expect our candidates to have some sort of assessment portfolio, which they will present to their sponsors, who will eventually sign them off for the clinical examination. Prior to commencing advanced training in psychiatry in the United Kingdom, it's expected that everyone should have passed the MRCPsych examination. So this examination is very important for anyone who wants to enter advanced specialist training in psychiatry in the United Kingdom. Okay, I'm going to take you through the papers first of all, and the contents of the papers. So paper 1 is a very general paper, and we expect anyone who has 6 months of post-foundation internship experience in psychiatry to be able to undertake this paper. And just a general list of some of the subjects that we're covering in paper 1. We do history and mental state examinations, cognitive assessment, basic psychological processes, description and measurement, basic psychological treatments. It's a very general paper, and anyone who has at least 6 months post-foundation experience in psychiatry should be able to undertake this paper. Paper 2 is more science-based. It's general principles of psychopharmacology. There's neuropsychiatry, evaluation of treatments, things like genetics, epidemiology. And our guidance for this paper is 12 to 18 months post-foundation internship experience in psychiatry. Paper 3 is split into 2 parts. A third of the paper focuses on research methods, evidence-based practice, critical appraisal, statistics and research. And then 2/3 of the paper looks at clinical topics and focuses on the other subspecialties: liaison, forensic, addiction, child and adolescent psychotherapy, learning disability rehabilitation, old age psychiatry, and general adult. And we expect people to have 18 to 20 months post-foundation experience to take this paper. That's a guidance that we issue. Now, the papers are all multiple choice papers, MCQs, so you're choosing the best answer out of 5 options, or extended matching items, EMIs, and they make up 25% of the paper. But the reason we moved to this was these are seen as, from an educational point of view, a more robust system of questioning, moving away from a true-false answer system. There's an agreed percentage for each topic area, and on our website we have details and a breakdown for our trainees as to the basic topic areas, and each paper is 3 hours. The written papers can be taken in any order. Now, this is just the eligibility criteria for our examinations. So all we do is, for the written papers, we just require 6 months post-foundation experience in psychiatry, and we have guidance timeframes for paper 2, 18 months, 12 to 18 months essentially, paper 3, 18 to 24 months. In brackets, we're just giving you the equivalent training years in the UK, so core training 2, core training 3. And again, the successful completion of an assessment portfolio, or if you're a trainee, the fact that you're undertaking work-based place assessments in the workplace and you're building up a portfolio called the ARCP. For our clinical exam, which is the CASC, we expect everyone to have passed papers 1, 2, and 3, and then they should also have, by that time, 30 months post-foundation internship experience in psychiatry. And that has to include a minimum of 12 months in adult psychiatry and a minimum of 12 months of 2 to 3 other psychiatric specialties. And we also ensure that individuals have achieved certain competencies in psychotherapy, learning disability, or child and adolescent psychiatry. For overseas post holders, though, because we have many individuals who come and take the exam from overseas, it's important that they have demonstrated to their sponsors an assessment portfolio indicating that they have undertaken certain set tasks. And I'll talk about those later. So what is the CASC? The CASC is a series of stations and split into 2 halves. So in the morning, a candidate will arrive and undertake 8 stations, and the stations are linked. So for example, in the first, you may go in and see a woman who has postnatal depression, and you're there to sort of elicit the history from her, find out what her problems are, find out what her concerns are. And you have 10 minutes to undertake the task in these linked stations, 2 minutes preparation time prior to entering each station. When you move to station 2, for example, you may encounter her husband, and it's for you to explain to her what the problem is and perhaps outline to him what your management plan for the patient is. So those stations are linked, and all candidates undertake a series of linked stations, 8 stations, and they take those one by one. In the afternoon, we look at more sort of simple stations, which are single stations. And they're basic scenarios involving a patient or a health professional, for example, or physical examination station. And those stations are 7 minutes long with 1 minute preparation time prior to each station. You either pass or fail a station, and you need to pass a majority of stations in order to pass the clinical exam. At the moment, we expect candidates to pass 12 stations out of 16 in order to pass the clinical examination. But what we do is we undertake a series of standard setting measures prior to the examination. We also use what we call a Hofstee method in order to achieve the pass mark, whereby we interview our examiners. They are asked to fill in a questionnaire based on the candidates they have seen that day and their expectations from what they have seen with regards to what they think the minimum pass mark should be, what the maximum pass mark should be. This is the blueprint for the CASC, and it's again available on the website, and it basically shows you the different areas that the stations will cover. So it's an indication to candidates about what we're trying to test so that they're able to prepare for the examination. Again, this is available on the website. We have 6 examination centres in the United Kingdom, the Republic of Ireland, and in Hong Kong. Overseas, we run the examination through the British Council offices, the written papers. And the college is currently in discussions with colleagues in India, with NIMHANS in Bangalore, because there is a demand for the exam in India. Our CASC examination runs in a UK centre, and this year we successfully launched the CASC in Hong Kong. It was 2 years preparation work, working with the Hong Kong College of Psychiatrists. We're also currently in discussions with other colleges around the world to tailor-make parts of our exam, components of our exam, particular to their needs. So they may not necessarily want to call it the MRCPsych exam, but they may be interested in components of our exam. And we're currently in negotiations and working with them to help them set up exams based on our clinical exam so that they can run it for their particular trainees. So a candidate who's overseas, particularly for the clinical exam, all they need to do is make sure, in order to be sponsored for the exam, they need to make sure that they have an assessment portfolio where they can describe various activities that they undertake in the workplace, which will allow them to take the clinical examination. And these are some of the activities that they can demonstrate. And these are based on the work-based assessment that our trainees undertake in the workplace. So things like mini clinical encounters, mini ACEs, case-based discussions, or assess clinical encounters. Again, all this is available on our website for you to download and take away with you. Thank you very much.